For the complication, the possible complication of the colonoscopy will be three groups. The first one is from the sedative medicine. Sometimes the patient wakes up and have a little bit of nausea or sleepy, but usually the medicine will last just like 2 to 4 hours and then it will disappear. So most of the patient will be recommended to rest on that day. No heavy exercise, no alcohol, no driving on that day. The second possible complication related to the procedure itself, because actually when we do the colonoscopy, the doctor will inflate the air to make the colon expanded, and then we insert the scope in the middle of the colon. So it will, usually the scope won't touch the colon at all. But there will be 2, 3, or 4 curves of the colon that we have to slide the scope through that curve. So there are some risks of the wall of the colon injury, starting from just a little bit of bruise until like bleeding, and the most severe complication is perforation. It happens about 1 in 3,000 cases, which is not very common at all, but there is a possibility. The latest possibility of the complication is the complication related to intervention. Just like when we do the biopsy, there is the 1% risk of bleeding, or when we do the polypectomy or polyp removal using the snare, that is about maybe like less than 1% risk of the perforation. Usually after the surgery for the early stage of cancer, maybe it takes like few months for them to resume the feeling that they are 100% normal. But most of the time, right now the treatment for colon cancer changed a lot, because we can do the minimal invasive surgery, which is like laparoscopy. Before, when you do the colon surgery, you have to do it open, and the patient has to be admitted almost 2 weeks. But right now, some patients of mine, they admit just for 3 or 4 nights, only after the laparoscopy, and then they can resume almost regular activity within few weeks.